association, whose members care for more than 16,000 BC seniors. For more on what they would like to see in tomorrow's budget, we're joined now by Mike Klassen with the BC CPA. Mike, hello.
Hello, Jeff.
Let's start off with what you'd like to see tomorrow for seniors.
Well, we'd like to see a lot of new investments and innovations in care. This is something that we launched about a month ago. Our Care Can Be There campaign has been out for several weeks, and it's really just to raise awareness of the need to make significant investments to increase the number of direct care hours for people who are in residential care, and to extend the stays for home care workers as well. And then there are assorted other recommendations in our roadmap for Made in BC care solutions that we have at our website.
Certainly, I want to ask you about a few of those in a minute. What are you expecting to see tomorrow? There's a lot of people with a lot of interest and a lot of need. You're competing for the dollars because there's really ultimately only one taxpayer at the end of the day.
Indeed. You know what? We've said from the very beginning that we know that we're in a very competitive marketplace. We're seeing either the fentanyl crisis or issues around housing. There's a lot of things that are commanding a lot of pressure on those public dollars, that surplus that everybody keeps talking about. So it can go away pretty quickly. Seniors care is one of those things that really cuts across all families. 3 out of 10 British Columbians identify as part of the sandwich generation. We've been talking about that for the last several weeks. So that any care that you can apply to BC's elderly can really help families. So what are we expecting? To be honest, our observation, and we watch what government does very closely, is that we'll get a little bit. We won't get everything that we're asking for, but our sense is that there will be dollars that will go directly to help people on the front lines delivering care in BC.
Is this going to be ever more important to advocacy work as the British Columbia demographics change? We've spoken a lot in years previous about the silver tsunami. I don't know if that's a term that people still like using, but the changing face of British Columbia.
Absolutely. Well, you're seeing an increase in the overall age of the population. That's happening over time. So that's why there's a sense of urgency. We really have been saying we can't really wait for another election cycle to try and make these kinds of investments. We're very proud of the fact today that the government of BC proclaimed this Senior Care Providers Day. And so there's a bit of symbolism in that, of course, but at the same time, it's a recognition of how important our care workers are and how really important we can help families by making these kinds of investments and some changes to the way that we deliver care.
That's what I wanted to ask you about, Mike. When we look at a particular area of service, a particular ministry, we often hear that throwing money at it is simply not the only solution. It's part of the solution in many cases, but changing how we do things is also critically important. Is that true here as well?
Oh, absolutely. Listen, I can't repeat this enough. Every time you have somebody hospitalized, it works out to be about $1,800 a day with all of the supports that you have in there. 13% of people that are in hospital beds right now in British Columbia could either be at home or in the community in a residential care setting. And that's about $200 a day by comparison. So you can really save millions of dollars in terms and reallocate all of that care in another setting if you were able to try and close down those acute care beds, those hospital beds, and move that care back into the community.
There's a provincial election coming. You probably heard about that, right?
Yes, of course.
Does your group have any particular intention over the coming months? Is there anything that not just the governing BC Liberals, but all parties should be paying attention to here?
Well, absolutely. We have been keeping dialogue going with the BC NDP, the BC Liberals, and the BC Green parties as well. And in fact, all 3 of them are attending our Care to Chat speaker series. It'll be the first all candidates debate, I think, of the election season. It'll be happening this Thursday. So we're going to be listening very closely to what the representatives of each of those parties plan to do for BC seniors and the people who are delivering care in this province.
If you had to pick one area to where we should start addressing this, you acknowledge it's not going to happen overnight, but if you had to pick one place, be it upgrading seniors' homes, improving mental health, including general health care, availability of care, where would you start? What's the most pressing area?
Well, we have a 4-pillar plan that calls for investing in people, infrastructure, innovation, and quality of life. But I would say that really one of the things that is really critical is that we need to invest in training for care aides and LPNs. We're starting to run out of those folks because of the increased demand on that part of the workforce. That is an area that you can't deliver the care if you don't have the workers. So that is something that's we've flagged at about $5 million a year that would allow people who are currently doing other careers and want to learn about really a very great career in the care sector is available for them if they have the appropriate training.
And certainly significant employment opportunities there. Mike, we are out of time. I want to thank you for yours.
Appreciate it, Jeff. Thanks.